On Monday, a new law will clear the way for needle exchange programs here in the state of Florida. Now, clean syringes in exchange for used needles. That's at taxpayer expense. At first, that might seem like a questionable way to spend your money, but as 10 News reporter Eric Glasser found out, a recent needle exchange pilot program was so effective, even the state's conservative legislator and governor have given it the green light.
I went through it in 1999.
Andy Seal has battled his own demons when it comes to drug addiction. Now he sees folks in our area using intravenous drugs, occasionally sharing needles, and possibly diseases like hepatitis and HIV.
They need to do something. It's pretty bad here.
This week, Governor Ron DeSantis signed a bill allowing counties around the state to create needle exchange programs, clean syringes in exchange for used ones. No questions asked.
I'm skeptical about this.
Hillsborough County Commissioner Sandy Merman cautiously supports a pilot program, at first hesitant to spend taxpayer dollars on syringes for drug addicts. But a pilot program in Miami convinced her the program works, slowing the spread of disease, giving health professionals an opportunity to counsel addicts.
It decreases the overdose deaths. We know that because if they're coming in with their needles, that means that we have a shot at educating them and referring them for treatment.
The program isn't perfect. Fresh needles don't help battle addiction.
They do stay disease-free, but they still are high on the drug if they're shooting their arm.
Still, the idea has reduced prison and emergency room expenses for taxpayers and helped to slow a public health threat.
It's a really good idea. It's going to stop the diseases here, man.
This is a tool that we need in our toolbox, and just a tool.
The needle exchange would likely be administered through each individual county's health department. How much to spend on it, whether to have the program itself, is something each county would have to decide. Hillsborough and Pinellas County are set to take up the issue at meetings in July.
Now, Florida is one of the nation's top spots for opioid abuse and overdose. The state is among less than 2 dozen which have now legally authorized the needle exchange programs.